Dr. Nathan Leavitt. Today I want to take a few minutes and talk about sciatica. That's kind of an interesting word, but it comes from the sciatic nerves in the body. I thought I would use this diagram, which is a really good diagram that shows the spinal nerves in the body. And it clearly shows the sciatic nerves. And so if you look at these nice thick nerves that go all the way down your leg and your feet, that's the sciatic nerve. You have two of them in your body. They're the longest, thickest nerves in the body. And when those nerves get irritated, it can cause a lot of grief. It can cause a lot of pain and irritation. And so it's important to know what causes sciatica. And so I want to talk about that today. It's important to understand that the root of the sciatic nerves is actually in the low back. And the sciatic nerve actually stems off of the spinal cord. And so what happens is when it gets irritated in the low back area, it will cause those symptoms. And so you can have low back pain with sciatica, but you may or may not have low back pain. And so you can actually just have numbness or tingling into the leg, or aching or burning, stabbing sensation down into the legs without the back pain. But those are the types of symptoms you have with sciatica. And as I said, the root of the problem will often stem in the low back, and that could be from inflamed discs or misaligned bones. The discs are the cushions in between the spinal bones. They're the pads, and they absorb shock and separate the bones and allow room for the nerves to exit the spine. But what can happen is those discs can get injured, okay? So some of the causes of sciatica, you could have a herniated disc, and that's where the disc actually tears and the inner substance that's in the disc will ooze out into the nerves and irritate the root of the sciatic nerve. Or you can have a bulging disc. A bulging disc is where the disc gets squeezed, and it will actually bulge into the nerve and cause those symptoms. Spinal misalignments, where the bones in the spine, when they get misaligned, it narrows the disc space, which will in turn cause that pressure from the disc onto those sciatic nerves, the root of the sciatic nerve, and cause those symptoms down the leg. Now, rarely too, you can get bone spurs, which would be like bony growth off of the spine, which will irritate the root of the sciatic nerve, or even a tumor. Very rare, a tumor can do it as well. But very commonly, those discs can bulge, or the spine gets misaligned and will cause those symptoms of sciatica. And so I have a lot of experience treating several patients with those types of symptoms. And it's important when you have those types of symptoms, you want to get to the root of the cause. You don't want to just treat symptoms. If you're just taking medication, often that will just mask the symptoms, and you're not getting to the root of the problem. It's kind of like if you're driving down the road and your engine light comes on, right, and that bothers you, you wouldn't want to just put a piece of tape over the engine light. You actually want to open the engine and see what's causing the problem and get it fixed. Same thing with your body. You don't want to just mask your symptoms with medication. You want to get to the root of the problem. Chiropractic is an excellent treatment for sciatica because it helps to get to the root of the problem, helps to correct the misaligned spinal bones, and help to get the pressure off the root of the sciatic nerve that can cause those symptoms. Core strengthening exercises are important as well. Another cause actually that of sciatica is muscle spasms. And what happens is as you can see, that sciatic nerve passes down the leg. Well, you have muscles that cross over that sciatic nerve, and when you get spasms in those muscles, that's another cause. It will irritate the sciatic nerve. One of the muscles is the piriformis, which is a common muscle. When it gets irritated or inflamed, will cause pressure on the sciatic nerve. And so doing stretches, core strengthening exercises as well are really important to strengthen your core and help to get to the root of the problem. And so we do, in our clinic, we actually do a combination. We do a combination of rehab exercises and core exercises and chiropractic, which is very effective in dealing with the problem and helping many people that have sciatica. So I hope this video has been informative. Please share it with others. Give us a thumbs up. Appreciate you for tuning in today, and we'll talk to you next time. Thanks.